Assalamualaikum warahmatullahi wabarakatuh. Hello and welcome to the special edition of World Hypertension Day and Salt Awareness Week podcast brought to you by Malaysian Family Medicine Specialist Association in collaboration with Department of Primary Care Medicine, Universiti Malaya Medical Center. So I'm Dr. Noor Mikraz. I'm a family medicine specialist from Serembantu Health Clinic, and I am delighted to be your host today. So for your information, World Hypertension Day is celebrated every year on the 17th of May, with the aim is to bring the awareness among our public about the importance of hypertension or high blood pressure. So it is a silent but a serious condition that affect millions of a population worldwide. So our theme for this year's celebration is measure your blood pressure accurately, control it, and live longer. So before we dive into our discussion today, I want to take this moment to thank all of you. Thank you very much, because our followers and audience. So since we've dropped the first teaser of our podcast, so we've been receiving an overwhelming question through our social media platforms. So it is truly inspiring. So I know that everyone is eager to learn more because we can see that everyone seems to ask the right question and want to take charge of our own health. So today we will be addressing some of the most frequently asked questions that we receive, busting some common myths and sharing practical advice that hopefully you can apply it in your daily life. So, and to help me with that, so we have a very special guest joining us today. So our first panelist, so we are very honored to have him here today, Dr. Wong Ping Foo. Dr. Wong Ping Foo is the family medicine specialist with a subspecialty in non-communicable disease in primary care. He is actually the Vice President of the Malaysian Family Medicine Specialist Association and also the head clinic at Choras Baru Health Clinic. Welcome, Dr. Wong. Thank you for joining us today. And sitting next to Dr. Wong, you can see a very beautiful lady there. Okay, and she is a Dr. Beh Hooi Chin, family medicine specialist and a medical lecturer from Department of Primary Care Medicine, Universiti Malaya Medical Center. And she is also a deputy president of the MyWash and a council member of the Malaysian Society of Hypertension. So they are two other great person to talk about our podcast today. Thank you so much, Dr. Wong and Dr. Beh, for joining us today. So our audience, for your information, in 2023, World Health Organization have released in their fact sheet on hypertension, they have reported that estimated about 1.28 billion adults worldwide actually have hypertension. And surprisingly, less than half actually know that they already have hypertension. So what about in Malaysia? So the National Health Mobility Survey report in 2023 reported that 1 in 3 adult Malaysians actually have hypertension. And even worse, in Malaysia, only 17.3%, right, Dr. Beh and Dr. Wong, that they actually know that they have hypertension. And 11.9% of the adult, actually they didn't know that they have hypertension. And this group, especially among the younger group, aged 18 to 39 years old. So to start our podcast today, Dr. Beh, maybe you can share with our audience, what is actually hypertension and why is it called as a silent killer, Dr. Beh?
Okay. Thank you, Dr. Mikraz, for a very nice introduction and a very good question. So I think hypertension is actually quite well known as high blood pressure or tekanan darah tinggi. So it's actually more like defined as an increase in pressure towards the wall of the vessels, the blood vessels in our body. So you can imagine like a garden hose, the pipe. So if let's say our pipe if let's say it's something that is blockage, or whether the pressure within the pipe too, like let's say it's increase in the pressure. So that's how we actually so-called it as hypertension or high blood pressure. So it's more easier for us to explain to our patients. So usually we use it as this description so that patient can understand what is hypertension. And why is it called it as a silent killer? Because usually if let's say, like you mentioned that the statistics were actually very alarming, that there's so many patients actually not aware that they're actually having hypertension. So because they do not have, because hypertension do not really have any symptoms. So if let's say the patient having a blood pressure about 140 and 90 or above, so sometimes they don't experience any symptoms at all, not even headache or giddiness or anything.
Yes.
So they might not aware, that's why, and also if they did not go for a checkup and there's no routine checkup and whatnot, usually they won't know that they have high blood pressure. That's why it's very important for us to advocate our patient and also to create awareness for them to actually go for a routine screening and routine blood pressure checkup where they can actually detect early. And then, like we also mentioned earlier, then prevention is better than cure. If they can detect early, then we can treat early as well.
Okay, Dr. Beh, actually, is there any limit in terms of when would you say someone has blood pressure? Is there any limit in terms of the blood pressure reading?
Okay, so usually the numbers you have to remember, it's to diagnose a hypertension will be more than and equal to 140 and 90 millimeter mercury. So 140 over 90. So if let's say that these patients have this cutoff of this number, then usually we will say that you have to measure twice, 2 times in 2 separate occasions. Then persistently having this higher than this number, then we can say that this patient have high blood pressure. But of course, it's also looking at also provided that the patient did not have any acute symptoms like fever or any acute infection that can cause the blood pressure to rise temporarily, then we can actually say that this patient have hypertension.
Okay. Interesting that you mentioned something about if you are having fever, then your blood pressure might goes up. So actually, this is one of the question that been asked a lot in our social media platform. So let's say in most days, let's say our blood pressure is normal, but then when you are feeling unwell, like having fever or you are having stress, and then when you measure, suddenly your blood pressure goes up. So in this kind of situation, would you say that these people have hypertension, Dr. Beh?
So because we know that high blood pressure sometimes can very alternate and also changes from different time, even morning or night time also they will have some difference as well. And also especially when the patient is having acute stress, let's say, or either they are having fever, because usually if the temperature is high, patient might experience like very high heartbeat, high heart rate, or even high blood pressure. So sometimes at this particular moment, we would not really say that they are having hypertension. So we might need to also measure like twice in 2 different occasions, but when they are well. So when they are well, but then with the 2 occasion and 2 reading also very high, like we mentioned the 140 over 90, then we can say that they are actually having high blood pressure or hypertension.
So what I would say that it's good once they have getting better, so get the blood pressure checked again, right, Dr. Beh? Okay, thank you so much. So like Dr. Wong, right? Hypertension doesn't happen overnight, right? So let's talk about what actually causes hypertension. Could you share some common risk factors who usually get hypertension?
Okay. I think we have these non-modifiable and modifiable risk factors for hypertension. I will talk on the non-modifiable risk factors. So basically, non-modifiable are the one that you cannot change. It's there that you cannot choose. Unfortunately, you cannot choose. And these are the things like age is one of it. As we all know, when a person age, the blood vessel tend to become more stiff, and then they cannot withstand tendency of higher pressure exert on the blood vessels. And this patient, for instance, like if let's say the age increases, the risk for hypertension increases. So especially if let's say you're more than 65, so on and so forth. And we also have non-modifiable risk factor like the gender. Unfortunately, male like me, we carry more risk of a higher risk
Chances
for
to get hypertension.
as compared for our female.
Okay.
But
So you're
having
safe,
said that,
Yeah.
having said that, I think once lady menopause, I think the risk is almost the same.
Okay.
And other than that, also we have ethnicity. So I think in the international Western country, I think we were saying about the African black and the white. African black had a higher risk of getting blood pressure as compared to the whites. And for Malaysia, we have local study, National Health Morbidity Survey that shows Malay are the ethnicity that carry the higher risk of hypertension. But that doesn't mean other race didn't have, but they also have risk for hypertension, but it's just that it happened more in the Malay. And we do also have genetic and also family history. So gene is something that we cannot change. So family history, if let's say both parents has hypertension, then we are highly likely to get hypertension as compared for those who do not have any family history of hypertension.
So that means the myth that people saying that hypertension is only happen to if you get older. So that is not right, is it, Dr. Wong?
Oh, yeah. That is not right exactly. That's not right. It's actually a myth. Even though I say age when higher, then you get but we have seen hypertension in very young age, young adults, as early as 20, 30, even in small children. But these are usually those who have any concurrent kidney problem and also maybe some other medical problem. Yeah, other medical problem related. But definitely it can happen in any age. Especially in younger adults. I think as you mentioned earlier, we have patients who are 18 to 39 years old who do not know that they're having hypertension. Only when they check, only they will know.
Actually, lately we are seeing more younger generation with hypertension, right? Yes. Okay, thank you so much. So just now Dr. Wong mentioned about things that we cannot change, right? All right. So I'm sure there are factors that can be modified, right, Dr. Beh? So would you like to comment on this, Dr. Beh?
So thanks for the question. So I think those modifiable risk factors, like meaning that something that we can actually change. So like especially we are what we eat, right? So whatever that we take and consume can actually contribute to certain degree of hypertension. So especially in the salt intake. So sometimes we know that we always eat out, busy working doctors and all. So sometimes eating out can also contribute because of the higher content of the sodium, which is the salt content in the food, which can actually increase the risk of getting hypertension as well. Or especially if those patients, they are actually hypertensive, and then they also will contribute to their uncontrolled blood pressure as well. So having said that, the other modifiable risk factor would be like obesity. So let's say patient with a very high increase in their weight. So those are the potential condition that actually we can advise our patient by reducing their weight. So there are some studies actually states that by reducing of weight of 1 kg, 1 kilogram, can actually reduce of 1 millimeter mercury of blood pressure. So that would actually something that we can play a very important role in terms of managing hypertension as well.
Okay, it's interesting that you mentioned about salt, okay, right? And we are also in the world salt reduction week, salt reduction awareness, right? Let's talk something about people always ask us in clinic, right? So nowadays we see that there are many types of salts out there. Okay, it can be Himalayan pink salt, sea salt, rock salt, and many people believe that these different types of salt are healthy options. Okay, compared to the regular table salts. Okay, some even claim that this special salt has special minerals that make their blood pressure better. So can you help clarify these hot topics, I would say?
Yes.
Right?
It's something is very interesting question. I was being asked by my medical student just last week. So they are asking, so what would be the difference of the pink salt, purple color salt, and all sorts of types of color of salt? So actually, their content of sodium of each of the one you mentioned, different types of salt, actually quite similar. there's not much of like significant difference in their sodium content in those salt. So we will say that actually, if their content are the same, so we advocating patients actually taking lesser rather than you're buying the different types of color or different types of salt. It's actually, they are the same. They are still salt as well. So we are actually advocating patient more on like reducing their salt intake rather than buying different types of salt. But having said that, there's another different type of salt which is actually beneficial for blood pressure reduction, will be actually what we call it as potassium enriched salt. So yeah, so meaning that they actually reduce the sodium, which is the sodium in the salt, but then they actually replace with potassium. Yeah, so also I think I believe that everyone also aware that potassium actually can help in the reduction of blood pressure. So by having both reduction in the sodium and adding with the potassium, is a synergistic effect to reduce our blood pressure. So if we're to having said that, to have choices of salt, the potassium enriched salt would be better choices. But again, it's still a lot of more things to be explored in this salt as well, especially for children, pregnant patient, and patient with chronic kidney disease that might need to be aware and cautious with taking potassium enriched salt.
So what's the important message that Dr. Beh would like to tell everyone, that the important is not the type of the salt, it's actually the amount that you take. So we have to be cautious on the amount of the salt that we take, right? So, okay, Dr. Wong, the theme for World Hypertension Day this year is measure your blood pressure accurately, control it, live longer. So my question is, can you walk us through the right way to measure blood pressure at home? So, and we often receive a question from our patient, is there any difference in terms of accuracy, whether you use the cuff blood pressure or cuffless blood pressure monitoring? So you know that with advance in technology, there are wearables like wearables that claim that they can measure blood pressure, right? Any comment, Dr. Wong?
Thank you, Dr. Mikraz. So I'm sure the question from the listener is very important, but I will handle on the home blood pressure monitoring first. I think when we want to talk about home blood pressure monitoring, first of thing, you need to make sure that you have the correct technique, because by having the correct technique, then you can actually giving you the correct result or more accurate result.
Right.
Okay, so when you want to measure blood pressure at home, basically I think the first thing you need to have, of course, your meter. So I think we will talk about meter first. So basically the meter I think you can buy from the pharmacy. Of course, this meter can be usually MDA registered, or it can be also validated to measure blood pressure at home. And this meter, sometimes you can actually go up to Google, the MDA list, or you can actually go to a British Association, or Hypertension Association, or American one. They have a whole list of blood pressure machines which are validated for that. And so once you have that machine, definitely I think we will be very excited how to operate this machine.
Yes.
So most of the time, our healthcare personnel will teach you. Okay, so it's very important for you to prepare the scenario. So you need to be relaxed. Okay? You need to be relaxed. You need to rest. Maybe 3 to 5 minutes before you measure blood pressure. Okay. So what you need to do is you need to avoid smoking. You need to avoid going exercise. You need to avoid eating 30 minutes before you check your blood pressure.
30 minutes before.
Yeah. Okay. So once you have that in place, and then you need to make sure that the posture is very important. The posture, how you sit. So normally this automated blood pressure machine is measure it's a cuff one when you put on the arm. Okay. So what you need to do is you need to slide the cuff on the arm. So the position is actually to put on the arm. The arm must be at the level of the heart. Okay. And then you need to make sure that the posture, you just ensure that you are leaning to the back, as relaxed as comfortable as possible, and then put your feet down, not to cross your leg. Make sure your foot is actually on top of the floor. So once you're on the correct position, then you can actually put in the cuff. When you put in the cuff, make sure the cuff placement is correct, and so even also the cuff size is correct. Okay, so normally in medical terms, I think we will say 80% of the width. You need to ensure that it covers 80% of the arm circumference. But in the layman word, we just use 2 fingers. Okay, 2 fingers to make sure that when you put in the cuff, okay, 2 fingers above the elbow crease, and 2 fingers make sure that when you want to say you want to.
So it's not too tight.
Yeah, it's not too tight. Because if it's too tight, then you will give a false result. Too tight will give a higher result. Too loose also not too good. It will give you a lower result. So basically, if you can fit in snugly, your 2 fingers is actually quite a good tightness. Okay, so you just relax and then you just press, inflate the machine. So of course, during the process of taking the blood pressure, it's very important not to do other thing other than sitting quietly, because it will affect the result. Okay, not to talk over the phone, talking, not to play phone. Okay, you just must stay still. Okay, then you will get your result. So of course, one result is not enough. Sometimes we will ask them to repeat another result. So another reading.
How fast after the first result?
It can be like 1 to 3 minutes, but 1 to 3 minutes. So you can have the second reading. So usually we will average out the 2 readings for the blood pressure.
So just now you mentioned that first, make sure you buy a validated machine. Okay, number 1, and make sure you have the correct posture. And interesting that you mentioned about posture in measuring your blood pressure, because we also receive question like query from our audience that they don't understand why when they are lying down the blood pressure gives certain reading, but then when they are standing up or in different position, then it will give different reading. So is there any difference in terms of your position when you are measuring the blood pressure, and which one to take, Dr. Wong?
Thank you, Dr. Mikraz. I think the question from the listener is very correct. Blood pressure affects surroundings, of course, with posture as well. So lying down posture have a lower BP, blood pressure, but when you sit up or stand up, it will be a bit on the high side. So basically, the best position to measure the blood pressure is on the sitting position. So that is the sitting upright position. That is the best position. So we recommend that for the measurement of the blood pressure. And back to the wearable that we have, the devices that we have. So basically, as we mentioned, I think they use algorithms from the AI technology and so on and so forth. But in terms of accuracy, still the automated machine with the cuff is still the
so the gold standard is the cuff one, right? Okay, all right. So
but of course, you can use that maybe for checking the trend. For those, especially for those who are not having the disease, you can checking the trend for the sake of checking, because
just monitor.
Yes, monitoring. But still, we still advocate for the cuff automated blood pressure machine.
Okay, so like Dr. Beh, just now Dr. Wong mentioned, if you want to take your blood pressure, so after 1 day you have to repeat another one. That is for the 1 session. But how frequent should we monitor our blood pressure? Because I've seen there are patients that doing it like 3 times a day. There are some patients doing it like just once a week, or maybe someone just once a year. Okay. How frequent we should monitor our BP, Dr. Beh? Yeah.
So I think if let's say for the home blood pressure alone, so home blood pressure we still advising patient, of course, if they can able to do it every day, that will be the best actually. And also during daytime, so we are actually advising patient to do it like early in the morning, like Dr. Wong had mentioned, so before food, before exercise, before smoking or alcohol, all that. So we advise patient to actually take the blood pressure at home early in the morning, and also evening before dinner. Yeah, so that will be the 2 readings that we can take, because there's some variation in the difference of the blood pressure daytime and also nighttime as well. Yeah, so that will be the best for us to advise a patient. However, if some patient like sometimes we know that working adults or sometimes elderly patients, they might not very good in using the machine. So as long as they can, as they are in the convenience way that they can do as much as they can do at home, then I think it's fine. As long as there's some home blood pressure for us for monitoring and for comparing with the clinic blood pressure, I think it's okay for the patient. Yeah.
All right, thank you, Dr. Beh. I think at this stage, I hope the audience have a clear understanding about when would you diagnose someone have hypertension, who are at risk to get high blood pressure, and then how will you monitor your blood pressure. So I think we should take a break for a few seconds, and then we'll come back after this. Please stay tuned.